COVID has set the whole world. It has created havoc all over the world. Now, the question is how to escape from that. First of all, don't allow yourself to get infected, and that can be best achieved by adopting certain COVID appropriate behavior like using mask, hand sanitization, distancing, social distancing, and avoiding crowded places. So one is most likely not to get infected if one takes these steps. Secondly, get vaccinated. By getting vaccinated, you will one can avoid getting serious. Even if one is infected, he will not become serious enough. So there will not be much threat to his life. So that is second. Third thing is what I am going to say today. Some innovative procedures which will prevent death. Not only they will prevent death, they will prevent getting hospitalized, they will prevent all these requirements for serious patients like ventilator, ICU, oxygen cylinder, and costly tests like CT scan. This can be avoided if one does these procedures properly. Uh, it's not only no matter whether beta, theta, or delta variant, no matter whether it's second wave, third wave, fourth wave, it will save lives and it will save all the botherations of hospitalization. Botheration not only for the patient but also for his relations, for his family members, and also it costs lots of money. So all these things can be avoided if one adopts these procedures, innovative procedures. In fact, there are two such procedures I have devised and designed. One is what I am going to describe today, and another one is I will describe in the next episode, during the next presentation, because otherwise it will become quite lengthy. So I am dividing it into two parts. Today one part, and next time another part. Now both the procedures are very simple and easy to do. They can be done in the do-it-yourself format. That is, you just can do it yourself within the comforts of your home. You don't need doctor, nurse, you don't need injection, medicine, anything. Just within the comforts of your home, you can do it yourself mode. Now, what is to be done, and next is what is to be done. Now, before telling that, let me tell you the principle which is behind these procedures I am going to describe today. That is, I am using what is called wisdom of the body principle. Wisdom of the body. Now, that can be achieved. The procedures involve blowing out, coughing out, sneezing out, and gargling out. Now, before coming to the procedure, one should understand the what is to be done, what is to be done, when it is to be done, where it is to be done, and how it is to be done, and before everything, why it is to be done. Now, as regards why it is to be done, I have already told that it saves your life, it saves all the inconveniences, it saves lots of money. So that is why one need to undertake these procedures. Next is what is to be done. The basic principle is to decrease the viral load in the body. Now, what happens if one knows the bit of the viral infection? Once one gets infected, the virus first occupies the nose and the throat region, that is the nasopharynx and the oropharynx region. Now there they keep on multiplying, and when the viral load, that is viral load, how many viruses are there? Now, when the viral load is excessive, some of the virus they go down to the lungs. And once they go down to the lungs, all the complications start from there. If they can be prevented from going into the lungs, nothing will happen. No, nothing serious. But once they go into the lungs, this ventilator is required, ICU is required, oxygen is required, all those complications will be there, and in some cases death is unavoidable. So that is, viral load is to be reduced. Don't allow the virus number to be so much that they go down to the lungs. Now in this case, we expel the virus from the body. by these procedures that I am telling, the virus gets expelled when it is in the nose and in the throat region, before it has gone to the lungs. So that is the basics of what is to be done. Now then, when it is to be done, now once one gets infected, initially, as I was telling, the virus will be there in the nose and throat region. So initially for 4 to 5 days. Now do this once you know that you are most likely you have got infected, having symptoms like fever, cough. Immediately start this procedure for 4 to 5 days. And every day you can do 4 to 5 times. And out of which one should be at least one should be before going to bed, and one should be after getting up from the bed, because the virus which might have multiplied during the night time, they will get expelled out when you do the undertake the procedure in the early in the morning after getting up from the bed. So otherwise, because it's very easy to perform, you can do as many times as you like, but 4 to 5 times is ideal. Now this is about those persons who have got infected. Now it also can be done by the uninfected person in some situation like that. Supposing you have gone to work, and most of the people they go to work, different types of work, whether it's office work, business, or whatever it be, or college. Now you return home in the evening or in the night. It's quite possible that you have got infected, the virus have entered from some source into your body. So after reaching home, you undertake this procedure. Even if some virus might have entered your body, they will get expelled out. So that is, the uninfected persons also can undertake this procedure. Then where it is to be done? Now since the virus will be expelled out from the nose and mouth, they might come into the atmospheric air, room air. So in that case, it's likely to infect other members in the family or in the home. To avoid that, you do undertake this procedure in an isolated corner of the home or in some place where others will not be present, and take certain precautions like sanitization, surface sanitization, hand sanitization, all those things. See to it that others in the home do not get infected. Now, lastly, how it is to be done. Now, before telling how it is to be done, let me tell you what are the items which are required to be used. Very simple. There is nothing, as I was telling you, no medicine, no injection, and no doctor, no nurse. These are the 2 sanitizers I have kept for own hand sanitization. This is tissue paper I have kept. Now one can do also without tissue paper. That is blowing out without using tissue paper, but in that case the virus will be in the air, in the room air, and it's likely to infect others. Hence it's better to use the tissue paper, which will trap the virus as they come out from the body. The virus, as you cough out or blow out, the virus comes out of the body, and that gets trapped in the tissue paper you are using. So that is the use of it. It can be done theoretically even without this. Second is we need sneezing is one of the components of this procedure. So for sneezing, sneezes do not come automatically. In some conditions, sneezes are produced, but you can artificially also produce sneezes by using certain items like this. This we call it sneezer plant. That is, when you rub it before the nose, one will get a number of sneezes. So it induces sneezes, hence it's called sneezer plant. Now this grows wildly. It's not this sneezer plant that I'm showing, but it's something similar to that. It's a herb, in fact. It's not a plant, it's a herb. And this grows wildly. If one can have it, this is ideal. But if it may not be available in most of the places, so in that case, you use another sneezing compound or material, that is sneezing powder. This is a powder this is commercially available in the shops, pharmacies. So you take a pinch of this powder, put it before the nose, nostril, and then one will it will induce sneezing. Number of sneezes will be there following this povidone iodine solution, which is commercially available, readily available, and this is for gargling. Now, this is in uh, some companies they produce ready to gargle solution. That is, just you don't have to dilute or do anything. Simply put it into the throat and gargle. So that will. This is something like that. So this is a gargling solution, common salt. So that will produce approximately 3% hypotonic saline. So that is another material that is to be used for gargling. And third, now I would like to tell a few words about the type of dustbin that is going to be used. Actually, the whole idea of telling this is that after undertaking this procedure, the tissue paper, etc., are to be thrown into the dustbin, and that will be put on fire at the end, maybe at the end of the day, or after all the members of the family they have done this procedure. So all of them together, they can be it can be put on fire for safety reason. And because of that, the dustbin should not be of inflammable material like plastic. So it could be either of steel or of cement or of clay. Now this is showing this one. It's a flower pot actually made of clay. So it's you can put the tissue paper onto this, and at the end of the procedure or towards the night, you can put it on fire. So that will keep the thing safe. Now these are the items that are required. Now the procedure. The procedure is basically, as I was telling you, the principle is wisdom of the body, and by that we expel the virus by forceful expiration. During normal inspiration and expiration, during expiration, virus comes out, and that's how it spreads in the society to other people. But when we apply forceful expiration, then more virus will come out of the body, will get expelled. And forceful expiration can be done in different, the common denominator of forceful expiration is in the blowing, coughing, and sneezing. In all these procedures, there is an element of forceful exhale or forceful expiration. So these are the steps, these are the procedures we are going to undertake. One is forcefully blowing. Now what you do, you can do without the tissue paper also. Going to the wash basin, you can blow out, you can cough out, you can sneeze out. But that is not very safe, as I was telling, because it likelihood of spreading it to others. So because of that, it's always preferable to use a tissue paper. But if you have to do in the without tissue paper, then you have to do it in the wash basin, and at the end of it, the wash basin has got to be sanitized. Now I am doing it in the ideal procedure, that's by using the tissue paper. Take a piece of tissue paper, keep it in front of the nose, then close the mouth and blow from one nostril at a time. Once blow from the right nostril, again you blow from the left nostril, and blow 4 to 5 times. The blow should be in a jerky movement, jerky blow. It should not be blow as such, but in a jerky. I'll just give the demo for that. Like this: close one nostril, then blow from the other one in a jerk. Close other nostril, blow from the other nose. This is in a jerk. Now the same thing is to be done using the tissue paper with the mouth closed. I close left nostril and blow from the right nostril. Again I close right nostril, blow from the left, like that. Then discard the tissue paper into the dustbin. Sanitize your hands. Now take another piece of tissue paper, put it before the mouth in this case, and blow from the mouth. In a jerk, 3 to 4 times or 4 5 times. Now along with that, you do some coughing exercise. like cough out, like that. This also forceful expiration. Now discard this tissue paper into the dustbin. Sanitize your hands again. So this is blowing and coughing. The next thing is sneezing. Sneezing produces a maximum expiratory force, and most of the virus are likely to come out with the sneezes. Now, the two methods I have told you, this one is sneezing plant, one is sneezing powder, sneezer powder. So, do the sneezes again, keeping a piece of tissue paper in front of the nose and mouth, covering both nose and mouth, because sneezes will come out both from the nose and mouth. So this sneezing will be there 4-5 times, as much as sneezes are there. And then discard this tissue paper also into the dustbin. Sanitize your hands again. And the last step, you have had blowing, coughing and sneezing. The last is gargling. Now there is scientific proof that by gargling, the virus comes out of the mouth region. There is scientific evidence for that. Now what we do for gargling is that I have two items. One is povidone iodine solution. It's ready for gargling, and I take about 10 ml into the throat region and gargle it for about 30 seconds, then throw it out. You have to go to the dustbin to do the, sorry, you have to go to the wash basin to do the gargling by both the procedures, by both the things. So one is povidone iodine gargling. Now the company or there is scientific literature is there, but it's not conclusive. They claim that this also kills 99% of the virus. Whether it's true or not, at least by gargling, the virus will come out of the mouth. It may kill or may not kill, I will not go into that, but the virus will come out. Now, similarly, after that, you do the gargling using this 3% hypotonic saline, which I have already told. Now, do the gargling again for about 30 seconds. Keep it in the throat region for 30 seconds and then throw it out into the wash basin. Now, this hypotonic saline, whether it kills the virus or not, that is controversial. But what it does, at least maybe that it kills the virus as well, but what it does, that is, without any controversy, is that virus will come out. Along with that saline, virus will come out of the throat. So that is about the gargling. So you have these procedures, undertake it, and you are safe from the coronavirus and COVID-19. Neither you can avoid not only death but also avoid many other inconveniences. Thank you.